7 to 50. And while New York City has not explicitly said that these are amongst members of either gay, bisexual, or men having sex with men, nationally, internationally, that is the trend. So a lot to talk about tonight. I'm going to pass it off to Senator Brad Hoylman. Welcome, Senator. Great to have you here, and welcome a few remarks from you as well.
Thank you, Borough President. Thanks for your historic leadership on COVID and educating the public. My family, my friends, my relatives, were all so appreciative of the information that you distributed to hundreds of thousands of New Yorkers during the height of the pandemic, and we could not be more grateful. And we find ourselves at another junction where there's confusion, unfortunately, around an infectious disease. And I really appreciate you bringing these two distinguished physicians, Dr. Asada and Dr. Varma, with whom I've worked in the past, and so glad to hear their insights. Mark, at the end of the day, and I know the two council members who represent significant LGBTQ population share this concern. What does monkeypox even look like? How is it transmitted? Who is at risk? And what do you do if you suspect you might have a case or know someone who might have a case? I mean, these are basic fundamental questions that we asked around COVID, as you recall, of course, and we need to start asking them now to be prepared. And this could not be a more crucial time because of so many visitors to New York City in the LGBTQ population in particular. So this is really important information. I'm so glad to be here. I'm going to share it with my constituents, and we're going to urge both city and state officials to take more decisive action based on, in part, what we learned tonight. So thank you, Borough President, and thank you to my colleagues for making this a priority.
Thank you so much, Senator. And I see we've been joined by Mark Harrington, who's one of the world's most renowned activists on public health, a veteran of many fights, and who's immediately engaged on monkeypox. And we're thrilled to have his voice here. Mark, we'll cue you in a minute. We're just going to allow for the electeds to quickly say hello. So Councilmember Bottcher, please, love to hear a word or two from you as well.
Thank you, Borough President. I really want to thank you for your partnership. And I want to thank my colleagues, Senator Brad Hoylman and Councilmember Chi Osei. I want to echo what Brad said, Mark, about your leadership with respect to public health, your chairmanship of the Health Committee and the City Council. You were the first person putting out a lot of important information during COVID on Twitter. I looked down one day, you had like 70,000 Twitter followers. I was like, whoa, that's because you are such an important source of information. And that's continuing in your role as Borough President, because as elected officials, one of the most important things we can do, and on many issues, is facilitate the sharing of information, because especially with public health, information is power. And we are so blessed to have access to so many incredible public health advocates like the folks here today. Hi, Mark Harrington. Really, really great to be doing this with you. So thank you all for this very important forum. I look forward to being as helpful as possible with this issue.
Thank you so much. And we have another one of the stars of the new City Council here, Councilmember Osei. We're so grateful you could join us, and be happy for you to say a few words as well.
Thank you so much, Dr. Fauci. Borough President Mark Levine.
Oh my God.
Your leadership.
For the record.
Your leadership is just something that I aspire to, mimic within my role in the council, especially when it comes to public health and addressing public health, as well as the intricacies of our society and how they are a prevalent feature to the public health crises that we experience here in our city, nonetheless the country. I'm so happy to also be speaking here alongside my colleagues in government, State Senator Brad Hoylman and Councilmember Eric Bottcher, as well as experts on this issue. This conversation is so important to have, especially in the month of Pride. While monkeypox is not, as of now, an STI or sexually transmitted, we are seeing rates of infection very prevalent in the gay community and in communities where men do have sex with men. And historically, when we think about disease that have been transmitted in our community, in the LGBTQIA community, there's been a lot of stigma, there's been a lot of fear, and something that I am happy that we're having a discussion on here today, alongside experts on the issue, is to educate people about both how to stay safe, as well as maybe some unreasonable fears that we may have, either about the specific disease of monkeypox or the community that's being impacted by it directly or more prevalently. So really looking forward to hearing the ins and outs about this disease, how we can all practice safety, as well as how we can all mitigate fear and unnecessary stigma. So I thank your leadership, Borough President Levine, for making this issue something that we could all be aware of and learn something about, because this isn't something that I think a lot of our elected officials are talking about right now, especially in this month of Pride. It's usually a month of joy and celebration, but also a month of safety, which you're always pressing for New Yorkers, especially those in Manhattan. So I'm looking forward to the conversation.
Thank you for those kind words. So I'll ask Winter from my team, can we make sure that Dr. El-Sadr can do screen share, because I'm going to cue her and I think she has a couple slides.
It's all set.
Okay, wonderful. So Dr. El-Sadr, please, we'd love to hear from you.
Thank you very much. And I assume you can see my screen.
Yes, we can.
Yes. Okay, this is a very brief update. And first of all, thank you for the opportunity to speak today and to be with my wonderful colleagues, Mark and Jay, with you all. I'm going to provide a very quick update on monkeypox and the outbreak, the current outbreak, and just a situation update. So first of all, as you said in the introduction, this is not a new virus. The monkey virus has been recognized for several decades already, and is endemic, what we call endemic. It has been reported for decades, largely from Central African and West African countries. I think what's unique about this outbreak currently is that there are cases that have been reported outside the region where monkeypox has been traditionally reported. And this includes, as you can see here from this map, several European countries, in North America, and also South American countries. Overall, as of June 8th, there have been overall, this is the known cases, confirmed cases, about 1,285 cases that have been confirmed globally. And you'll see here the numbers by various countries and in the United States at that point in time. And this has been updated. I'll show you the update amongst 40 individuals as of that date in the United States. But if you look at more updated data in terms of monkeypox cases in the US as of today, there have been 65 total cases confirmed, monkeypox or orthopox virus cases. Orthopox is kind of the family of these types of viruses, and monkeypox is confirmed, meaning it's a specific monkeypox virus that's been confirmed. And 18 states have reported confirmed cases of monkeypox. It remains unclear as to how the people were exposed to monkeypox, but early, as was mentioned, of course, early data suggests this largely the majority of cases have been amongst gay, bisexual, and other men who have sex with men, who have made up the highest number of cases that have been reported thus far, although it's important to say that it's not been exclusively among this population. In this map here, you can see the states that have reported cases of monkeypox, and the numbers here are listed. And as you can see here in New York, 11 cases have been reported from New York. Now, this is an update, an earlier update, and this was the first investigation of, this is a publication from the CDC, and they looked at the first initial 17 cases. There's some interesting information from those early cases. 14 of the 17 initial patients with confirmed monkeypox reported international travel involving 11 countries during the 21 days prior to the onset of the symptoms of monkeypox. And 16 of the 17 initial patients were identified as men who have sex with men. And then they've shown a lot of different kinds of symptoms, and these include, of course, a very characteristic skin rash. I'll show you some pictures of this, but chills and fever and malaise and enlarged lymph glands and have been reported by by the numbers of individuals noted in the brackets here. But you'll see that a large proportion had chills and fatigue and malaise, and also getting swollen lymph glands is also pretty characteristic. And 12 of these 17 patients, they reported something, what we call these symptoms they developed before they got the rash. So it's really important that people be attuned that there's some very non-specific, kind of vague symptoms that can often predate the onset of the specific rash. And what's important to note is that 8 of these patients, the rash started in the genital and perianal area. And then as of New York City, the data from New York City Department of Health and Mental Hygiene, they show that as of June 13th, there were 10 confirmed cases of monkeypox, orthopox cases. And fortunately, thus far, most people have had mild cases. There have not been any hospitalizations, and people have recovered on their own. So this is quite reassuring. And also importantly, is that what the city is reporting is that most of the recent cases, they reported no prior travel or exposure to somebody who's traveled. So this means that people have to be quite vigilant and not just assume that if they haven't traveled themselves or they haven't been in contact with someone who's traveled, that they shouldn't be cognizant and vigilant about the possible symptoms of monkeypox. Now, what are the transmission and the symptoms? Again, it's transmitted from person to person, and we highlight strongly that this is through close contact with the rash itself, with the lesions themselves, or other body fluids, or importantly, what we call fomites, and that's a fancy word of saying contaminated, like towels or sheets and so on, materials that have been in touch with the lesions in somebody who has a monkeypox, and possibly through the respiratory route. But the close contact is really the fomites are what we're highlighting most prominently. It's not considered to be a sexually transmitted infection as of yet in the typical sense of the word, but of course, because sexual contact involves intimate and skin-to-skin contact, it's possible to be transmitted during sex. Incubation period from being exposed to beginning of symptoms anywhere between 5 and 13 days, but can range as long as 21 days. Like we said, usually people recover by themselves, which is really important, but we are concerned about people who might be immunosuppressed, and as always, children and pregnant women and people with other conditions. These are a few photos of some of the characteristic rash, which is just important to point out. And as you can see here, it can take different forms and different color pigmentation based on the individual's own skin color. But we have this raised, it has pus in it, a pustule, what we call, and it can appear on the palms, on the soles of the feet, as well as anywhere on the body. And as I mentioned earlier, this has also been reported in this new outbreak, primarily and often in the genital and perianal areas. Fortunately, we do have some treatments and also means of prevention of monkeypox. There are 2 different types, clades, what we call clades, or variants, one way of calling them. One is a West African clade, and which requires only supportive care typically. And the virus that's been isolated in this outbreak has been the West African clade. So that's reassuring, is that mostly the cases have been, people have recovered, although obviously I have to always remind individuals that it's really important to seek healthcare if you suspect having been in contact with somebody who has monkeypox, or if you have symptoms yourself, and to seek attention as quickly, medical attention as quickly as possible. There's some antivirals that are available through consultation with CDC, and contacts of the patients should monitor their health for 21 days. And if you develop any symptom, to immediately isolate. There is a possibility for contacts to get what we call post-exposure prevention with 2 licensed vaccines. That's a possibility depending on whether the person is vulnerable to complications of monkeypox. And also it's possible to use these vaccines as well in certain settings, like amongst healthcare workers, to protect them as well. if they're likely to be in contact with monkeypox. So that's it from my end, and I'll stop sharing here and hand it over back to you, Mark.
That was an extremely informative overview, Dr. El-Sadr. Thank you so much. Dr. Varma, we'll pass it on to you.
Great. No, thank you very much. It's great to be invited to this, and I really appreciate all the elected officials for bringing us together. I just was going to highlight a few additional points in addition to Wafa's very thorough presentation. I think the first thing to emphasize is, of course, what Wafa has mentioned, that we're trying to really balance between making sure that people have the information they need to protect their health, but also not generating a level of alarm that is disproportionate to the level of the problem. And so let me explain sort of, on the one hand, I think the good news that was sort of, in Wafa's presentation is that so far in the United States, there have not been any severe complications of this disease. Similar to what we have seen in dissimilar to what we've seen in outbreaks that have occurred in Africa historically, where anywhere from 1% to 10% of people who are infected are dying. That is not occurring in the United States right now. At the same time, what is concerning is that this is an infection that is quite contagious when people have it. And more importantly, it can be associated with other complications. Damage to your eyes, damage to your lungs, damage to your brain. And so we know COVID is just another example. Nothing good ever comes from, a virus spreading rapidly in any place in the world. So that's the reason to be cautious. So that's kind of number one, is trying to balance here between, while, people aren't getting severely ill as of yet, we do worry about the risk of complications. The second reason that I've been concerned about this is it is presenting in a way that really lends itself, unfortunately, to increasing the number of cases here in the United States and increasing at a level that we may not recognize. First of all, because the rash, because this infection is so far been largely concentrated among gay, bi, and men who have sex with men, infections are being transmitted, we think, primarily through, the touching together of the genital and anal areas. And so people are getting small little bumps in and around their penis and their groin, around their ass. And the dilemma with that, of course, is, as you can tell from those pictures that Wafa showed and others have described, they can be hard to detect at first. So your symptoms may not be very severe. The bumps, they may be in and around your ass in a place you can't see. And so it lends itself to people inadvertently being able to transmit to lots of other people, particularly if they go and play with a number of partners in any given night. They may not know. So it's not something that we're going to catch as easily. Classically, monkeypox started with a rash, as it was described in Africa, predominantly on the head and neck, and the face. So it's very easily to know if you had it or not. So in this situation, what worries me a little is the locations people are getting sick are ones that don't lend themselves easily. That's number one. The second is what we're seeing from both the epi and the virus data, which is that so far, very few people can recall having had sex with a partner who definitively had a rash. Now, that's probably because they had a lot of different partners, maybe at any given time or in that period. But at the same time, it makes it really difficult to do what we call contact tracing, as you know, to really know where people got infected. So when there are a lot of people getting infected and they don't connect who they got infected to before, it always makes you worry that the number of true cases is much greater than the number that you actually know about. So the number of reported cases is just a fraction of that. The other thing that is concerning is from the virus data that has been released mostly in Europe, but as CDC is now starting to talk about, is that there appear to be more than one strain of this virus in the US, which suggests that there's more than one, what we call chain of transmission, or people spreading to each other. So all of that is to say, and to emphasize, I do think this is something that people, in the United States, in New York City, need to be concerned about. Particularly right now, we're raising the alarm among the gay, bi, and MSM community because that's where the infections have been concentrated. There's nothing about this, though, that makes it a gay disease in any way. It just so happens that this is the community that was unlucky enough to have this start and spread first. But for now, that's where we're concentrating our efforts. And I would really emphasize that kind of the messages we're trying to get out to people in the community is, if you're going out to meet other people for intimate contact, whether it's sex or any other type of kind of naked or things where your clothes will be off, check your temperature or keep track of your health. If you don't feel unwell, think about not going. If you have any unusual bumps in your penis or in your groin or around your ass, take a picture, have a friend look at it, and be cautious if something happens. And if you have any lumps in your groin, take them seriously. And then by taking them seriously, I'm really talking about, the city has a number of sexual health clinics that provide great service, and it'll be really your first line, I think, for knowledgeable, good care for this. So I'll stop right there. Those are kind of the big points I wanted to highlight.
Well, thank you so much, Dr. Varma. Very, very, very helpful. Mark Harrington, a veteran of so many of these public health fights. We really are excited to hear your perspective on monkeypox and what it means for the community.
Well, thank you so much, Borough President, and thanks everyone else for joining today. I have to say, without meaning to make light of it, but we once again have been caught with our pants down with a global pandemic that we were not prepared for. And so a lot of what I'm going to say has much more to do with questions than it has to do with answers. I read people saying that it's not an emergency, that it's not spreading that fast. I think there's a lot of things we don't know. But the first thing I want to point out is that this isn't a new virus, and it reflects the inequity that the world has dealt with for centuries with respect to diseases that affect mainly the poor. And in this case, it's been circulating among humans in Africa for a long time. But I also want to emphasize that the stigmatization of infectious diseases doesn't just happen for LGBT people. It happens for people of color. It happens for sexually active people. It happens for women. It happens for Asians. It happens for Africans. It happens for Haitians. And so when we talk about infectious diseases, I would like to suggest that we move away from the kind of stigmatizing language that we've been having for the last more than 100 years. And so that, for example, with the strains of SARS-CoV-2, they used to be referred to by different geographic sort of origins of that microstrain, and then the World Health Organization adopted a new nomenclature. I think it's important to adopt a new and less stigmatizing nomenclature. Another thing is that monkeypox doesn't even come from monkeys. So it's misleading, but I think that also feeds into some racist stereotypes, and it concerns me. Then the discussion about sexual transmission is somewhat concerning, because there's a lot of other ways that you can get in touch with somebody's genitals or butt than by your butt or your other genitals. You can do it with your hands. You can do it with your lips. The question about airborne transmission is concerning to me, because I read up on the smallpox fact sheets on the CDC and World Health Organization websites. There's no question that smallpox, a related virus, is transmitted via the respiratory route as well. I don't think we know about asymptomatic transmission. If there's 21 days between infection and symptoms showing up, there is likely to be a period where there's a virus that's transmissible before maybe the bumps have begun to show up. But I don't think we have the science to answer that. And so as a treatment activist, my quest is going to be for more and better science and more and better information. And I think one problem that we had with the start of COVID and with the start of HIV 40 years ago is the lack of a really good test. It concerns me that we don't have local labs that are able to test rapidly for this. And if I'm wrong, maybe Jane and Wafa will correct me, but I think that we need to get tests to be closer to where people live. Having the CDC have a monopoly on testing and treatment and vaccine supply is not good. I would suggest that we would want to think about having just for everyone present, one of the most effective ways that smallpox was eradicated was through a strategy called ring vaccination, which is where you vaccinated everyone that was close to somebody that had been identified as having smallpox. And that's something that can be done with the existing vaccines that we have and that we know work against transmission of monkeypox. So, for example, people that are healthcare workers that are treating or diagnosing people, maybe there should be some studies to be done now of getting that vaccine out and doing some ring vaccinations to some different groups at risk to see how we can actually do it. We shouldn't have to wait 2 years or or even 1 year like we did with COVID, because there is a vaccine there. The government has a lot of doses. It's not clear where they are, how quickly they can be shipped. But I'm not reflecting out of panic, but really out of thoughtful planning to the electeds that are here and the public health officials and the researchers, that we could learn a lot and do a lot better than we did 2.5 years ago or 40 years ago. And I want to mention in closing the work by Dr. Joe Sonnabend and Michael Callan and Richard Berkowitz in 1983, when they wrote a pamphlet about how to have sex in an epidemic. And that pamphlet assumed that HIV, or that the unknown pathogen, was sexually transmitted, and somewhat like CMV, which is another virus that could be sexually transmitted. But a lot of these pathogens are not transmitted only by sex, and some of them can be transmitted, for example, by kissing, which most people don't consider to be the same as penetrative sex. And so I think I would like to know a lot more about where the virus is, how it infects people, where it goes in the body, how long it lives there before it makes symptoms, whether there's a lot of asymptomatic carriage and transmission going on. And none of that can happen without a lot more research and better tools. But unlike with AIDS in 1981 and COVID in 2019 or 2020, we do have treatment. We do have a vaccine that works. And so my question for the scientists here is, how quickly can we roll out better testing and better assessment of how to use the tools that we do have? Because in some respects, we're in a much better place than we were with those other two viruses when they first entered humans.
And I want to give the scientists a chance to answer those excellent questions. And thank you, Mark, for, first of all, what you've done over the decades and your unbelievably powerful perspective now. We're going to try and get to as many questions as we can. Please keep them coming. There's so many good questions in the chat. We're seeing everything you're posting, so keep it coming. And what we'll do is we'll do a round robin where my elected colleagues can ask questions or pick some out of the chat, or do both. But maybe and we'll go to Senator Hoylman first in a moment. But since Mark asked a question of our doctors, could you all maybe Wafa just weigh in on the question of testing that Mark just asked?
Yeah, I think Mark raised a lot of questions that are extremely important and timely, and some of them we might have answers for and we can resolve, and others we really need more research, more studies to be able to answer. But I do think his comment about testing is valid, because at this point in time, if a person has evidence suggestive of this virus, then the specimen needs to be sent to the Department of Health for a first test, and then if that first test is positive, then it needs to go to the CDC for confirmation. At least that's the way it was about a week ago. There may have been some changes in this week. So I do think that getting the testing, the ability to confirm the diagnosis closer to the patients is really important, because as you know, a lot depends on this. First of all, the anxiety, obviously, of a person who's suspected with this monkeypox virus, and being able to tell that person yes, yay, or nay, to offer them treatment if they need treatment is very important, as well as, of course, for all the contacts as well, and to assuage anxiety or to do some fairly intensive contact tracing. So I do think having rapid diagnostic capability is very, very vital in order for us to catch as many cases as possible, to be able to do the right thing, and also to be able to handle and manage and seek the contacts also as quickly as possible.
Jay, could you maybe just very quickly add from a patient's perspective, how do I get a test? What's the test like?
Yeah.
So experience with COVID testing, but this is very different.
Well, it's actually shockingly not that much different. And I'll keep this brief because I see there's a lot of questions that we need to get to. But just to emphasize, everything Mark said is spot on. I am quite worried that CDC is not moving as fast as it should on answering the unknown questions that need to be answered in partnership with communities and providers, and having some of the sort of bureaucratic snags that interrupted making COVID testing more widely available. So for all of you who are elected officials or activists out there, this is a drum to beat on. It's really important, particularly the one about diagnosis. So in terms of diagnosis, the most reliable way to diagnose this infection is when somebody has an actual lesion, and we use the word lesion to mean anything from kind of a faint bump that you have, a faint, mark that you have, to a full-fledged bump that has pus in it, is to see a medical provider and have that medical provider use a swab similar to the ones that they use for COVID, and rub that material, ideally dig into it and get some material on it. They put it in a tube. The tube is closed up and sent to a lab. Here in New York, it goes to the New York City Public Health Lab. They do the same type of technology called a PCR test that you'd have with COVID, and it'll give you a preliminary result back, and then they send that specimen to the CDC for the full confirmatory testing. There are other ways to test for this as well, too, and I just want to highlight those really briefly. Related to Mark's concern about the possibility of this being transmitted through the air, it is well known that people with monkeypox can get, if you swab the back of their throat, similar to not the nasal swab, but the gag you had in your throat often with COVID early on, that can also give you a positive test result for monkeypox, which is why there is this concern about how much you could be transmitted from, across the air for people. So you can do an oral swab to get a diagnosis. I don't know if the health department's recommending that now, but I assume that's part of the diagnostic process if necessary, if you don't have physical lesions on your skin. There are also blood tests that have been used in research settings, but I'm not aware that any of them are being used right now for public health response. And those include both testing for what we call the antigen, as people have heard about, as well as the antibodies. And so I say all that extra information there to emphasize why it is so important for people to be pushing on the federal government to move faster, because there is a way to get diagnostic technology to people faster, and these different approaches will help.
Excellent. Senator Hoylman, please.
Thank you. Thank you, Borough President. This has been incredibly informative, and it's good to see Mark Harrington, helping lead this conversation too. My question is really based on what I'm hearing from constituents, which is, are there any photos of what a lesion might look like adjacent to genitalia? That's a specific area that, we don't always easily find photographed and readily available on websites. So that's number one. And number two, what should, for example, men who have sex with men, what should their approach be over these next few weeks and months? Do they do anything differently other than is protective sex with the condom being recommended by anyone? But that would seem at the same time not to be an absolute protective regimen. So are there any steps that anyone is suggesting at this point? And then third, I would just say we have spoken to the city and state health officials about getting culturally appropriate and readily available information for our constituents and for everyone in New York about this. But those are my first two questions.
Wafa, do you want to start, or do you want me to start?
Sure, I can start. I think in terms of culturally appropriate information, I'll start with that first. That's absolutely critical. I think actually the CDC came out with a fact sheet that I thought was quite helpful and useful in plain language, and provided some really pragmatic, practical advice, particularly the population at risk that we're talking about. So I thought that was incredibly helpful. I know that several other organizations have also put out similarly educational materials, but I certainly found the CDC one to be quite useful, and I at least encourage people to take a look at that, and we can put that link in somehow in the chat box, I guess. And then the other issue is that in terms of lesions and photographs of lesions, we're beginning to see now more photographs of lesions based on cases that have been reported outside the endemic area. Until very recently, all the photos that have been available, whether it be in the medical literature or on the web, have been largely from endemic area, as I think Jay mentioned. But I think now we're beginning to see some photos that are from individuals who've had this disease from non-endemic, from Europe and from the US and so on. So some of those are available or beginning to be available. So I think that will be, and more will be available as more cases are reported. And that's very important because as was mentioned, the manifestations appear to be different and the locations appear to be different. I think in terms of what to do, we don't, as I mentioned, it's not thought that this is a traditional sexually or solely a traditional sexually transmitted infection where a condom would be protective. I think the lesions may be anywhere else on the body. In addition, we don't know yet about the ability to transmit through the respiratory route, so that close contact with someone who's suspected to have this disease or this infection or who has lesions would not be advisable. I think that would be, I think that's important to keep that in mind, because there are lots of questions that remain, and I think it behooves people, if they suspect someone might be not feeling well, even though the symptoms are non-specific or has specific lesions, it's a good idea to actually avoid having close contact with that individual.
Yeah, I would just add that I think this is what makes it so challenging, is because again, if you're a young gay man and it's the summertime, if you're anybody, you want to be out and about. Doesn't matter if you're a man or a woman or whatever. You want to be out and about, and these early symptoms are not so severe that people are going to use them to want to stay at home. And then you have to stay home for an extended period, and the diagnosis is delayed. So this is why this like early access to care and diagnosis is so important. We want people to be able to enjoy and live their lives if they're not at risk of transmitting infection. And so we all understand human behavior. So this is what makes it really challenging.
I want to cue Councilmember Bottcher, but very quickly, Dr. Osada, a few people in the chat have asked to see the slides that you presented. Is it okay if I say we'll send them out to folks?
Absolutely. Okay, yes, absolutely. I'll send them right after this.
Okay, wonderful. Councilmember Bottcher, please.
People in the chat have been asking about, can you get it from a toilet seat? Can you get it in the bathroom at work? So I really wanted to give you the opportunity, the experts, to put a fine point on this and communicate to folks how concerned they should be at work, and really, what does this mean? Just to be very clear with everyone.
Yeah, this is going to be an area in which the information is going to evolve over time. And I also saw some questions about laundry. So let me touch on those right now.
Yeah.
So I'll start with the scary thing, which is that in theory, any type of physical surface, if somebody has a skin lesion, let's say I have a lesion on my hand and I rub it against the surface, in theory, it could stay on that type of surface. And I personally don't know, and I'll defer to Wafa if she knows more, what types of surfaces have been evaluated in terms of, a porcelain tub or a metal or something else. So in theory, yes, there is a risk of that. Now, let's talk about what's likely and what's the reality. The reality is we know that even though there are far more cases out there than the number have been diagnosed, this is not spread hugely throughout the city. So I would not recommend that people, be afraid or take extra precautions in those types of settings. What I would say is that if you are going to a sauna or a play party or something like that, it's important for people at those places to do a skin check before or after. Let's, work with the organizers, work with people to check their skin. And it's probably a good idea not to share towels that people are rubbing against their bodies and other things. The same question got asked about shared laundry services. So we know that a regular laundry process, the machine itself with the heating and things, is adequate to disinfect this. CDC, EPA, other people, WHO has weighed in on this. The challenge becomes if you're in the laundry room, are you putting your clothes next to somebody else? Again, I think it's very unlikely, but I can't say that it's a zero risk. Wafa, do you want to help maybe clarify or correct?
Yeah, no, I agree with Jay completely. I mean, I think, again, it's important. We don't want people to panic. I mean, I think people to be concerned and vigilant and knowledgeable. But again, what we know is that this requires close contact. And, again, it's not casually transmitted as far as we know. So that's important to keep in mind. And you have to think of the context in which you're in. And like I said, it's a good idea not to share towels and sheets and so on if somebody who you suspect is ill or who may have skin lesions. But we know that heat does kill this. heat, like in the dryer, in the washing machine, does kill this virus. So I think that's reassuring for people who are concerned about washer dryers and so on, and laundromats.
I don't know if Councilmember Osei is still with us. It's budget night, and I know he had a very busy schedule. So I think he may not.
I think he and I both need to run down to City Hall. We're being told that things are coming together. But before I go, I just want to thank you so much, Borough President Levine and Senator Hoylman and Dr. Varma and Mark and Dr. El Sadr. I really appreciate this opportunity. Thank you for doing this for our constituents.
Absolutely. So I'll just jump in with another. There's been a series of questions on the chat about vaccination and the question of, particularly the question of preventive vaccination, which we've all done, or hopefully we've all done for COVID. And Mark Harrington has posed the question of ring vaccination. So if there's a known case, can you broadly, preventively vaccinate people who might have been in contact? Could you talk about I guess how effective the vaccine is, how good the supply is, and who should be thinking about getting one, how a person might access one, et cetera?
Wafid, do you want to go first or me?
No, go ahead, Jay. Yeah.
Okay, so there are basically two vaccines that are available for this virus that we know about. One is the smallpox vaccine, or at least a sort of updated version of it that's available, which is believed, based on pretty good science and experience, to provide protection against, monkeypox, as well as if you give it to somebody after they have been diagnosed and you give it very early, after they've been exposed, so very early on, it may prevent both the disease and, if they get the disease, make it less severe. So there's a smallpox vaccine. The second vaccine is a vaccine that was specifically developed and is specifically approved for monkeypox, which is called the Jynneos vaccine, and it's made by a Danish company. I don't know the exact number of dosages that were available. There was a lot of back and forth about CDC originally didn't want to disclose how much of the stockpile it actually had of this, but it also has placed this very large order with Bavarian Nordic, the company that makes this Jynneos vaccine, for this. So right now, CDC says vaccine is available and it can be ordered, but it has to be done as part of a public health response. Let me talk just really briefly about the two different vaccines and what we know and don't know. The challenge with using the smallpox vaccine is that is actually a very difficult vaccine, both to administer to people. It's not a regular shot in the arm. It's a very unique way of administering it. It gives people a local skin reaction. There aren't many providers who are used to doing it, and it can cause some side effects. So that is a vaccine that I think is very unlikely to be used broadly in the United States. The updated vaccine, the one that is most likely to be used, the Jynneos vaccine, has been used in laboratory workers in the US. So these are people in the US who do research on smallpox or monkeypox or any of these types of viruses, and you get protection from that. So there's not a tremendous amount of data about that vaccine. All the data we know about sort of the effectiveness is kind of inferred from laboratory studies looking at the immune response that people has. There has not been sort of broad scale use in thousands or tens of thousands of people as part of an outbreak. So this is where some of the challenge comes in. And I know in Montreal and I know in the UK, they've been offering, and I'm not sure whether it's the Jynneos vaccine or the small, but they've been offering vaccination. But I think one of the challenges with sort of advocating for broad scale use is the fact that public health people don't have a tremendous amount of experience with using these vaccines right now, right? So it's not like it's saying like the meningitis vaccine, where we had an outbreak that was predominantly in men who have sex with men, in 2010, in 2012, 2013, or hepatitis vaccines that we know and we have tons of experience tested on tens of thousands of people. So I do think that we're going to have to do the strategies that Mark has recommended. That what Mark is describing is that ring vaccination, which is, I name my contacts tell me all the people they have either had sex with or close contact with or might have contacts, and you vaccinate contacts and contacts of contacts. That is the type of strategy that will need to be used. The challenge with doing it so far has been this delay in diagnosis, right? People get symptoms, may finally get sick. They go to one provider who thinks they may have chicken pox or herpes, and then they finally get diagnosed with monkeypox. By the time that happens, it's a bit too late to vaccinate your contacts and even your contacts of contacts. So that's the challenge that we're running into, and why we keep coming back to this issue of more rapid diagnosis. Wafa, other things to add here?
Yeah, and I think that's the rings kind of vaccination that Jay described is what was used essentially to eradicate smallpox. To go after the case and rapidly identify the contacts and vaccinate in these kinds of rings around the specific case, so we know it can work. But there's so little experience, as Jay mentioned, with these vaccines in more recent years. The question about whether people who received smallpox vaccine, I'm one of those, I guess, older people who received the smallpox vaccine. There is certainly some data to suggest that people who received smallpox vaccine may be somewhat protected, but it's also acknowledged there's waning of that protection over years. And that's thought to be one of the reasons why we might be seeing this endemicity of this monkeypox in some parts of the African continent, since a lot of the generation that received the smallpox their protection has waned, and the younger people obviously have not been vaccinated since the eradication of smallpox in the 70s.
Excellent. We've had a number of people in the chat are asking about getting a copy of this discussion. So we are going to have a video available shortly after this program ends that we'll share with all of you who are part of this conversation, that you then can pass on to friends. And we said earlier that the great slides that Dr. Osada presented in the beginning will also get out to folks. So you'll have a chance to review this and spread the word. I'll pass to Senator Hoylman in a second, but I'll just try and hit a couple of the quick questions that are coming up here. Some of them we might be able to deal with. Someone asked if I see lesions, they use the word quarantine, but I think the question is, if I see lesions, do I need to immediately isolate?
Yes, definitely. And try to get to a knowledgeable medical provider. And also when you go there, make sure you're wearing a high quality mask and you keep all of those skin lesions. In fact, just to be safe, keep all of your skin, except for maybe your head, as covered as much as you possibly can, and let them know.
And to seek attention as quickly as possible, obviously.
And you might have deliberately said, Dr. Varma, see I think it's a qualified provider, or does that mean someone really should go to a sexual health clinic, or a certain kind of physician, or a certain venue, or can you go to your regular general practitioner, or et cetera?
Yeah, so tough question. And the reason I use that language is I'm really worried that a lot of general providers, are already pretty inadequate when it comes to run-of-the-mill STDs. Or again, this is not an STD, but it's transmitted during sex, for example. So I worry about the quality of diagnosis. If you're in New York City, you have the advantage. Let's say you're in Chelsea, you're in Eric Bottcher's area. The Chelsea Sexual Health Clinic is an ideal type of place to go. I'm going to assume, that folks at places like Callan Lord and other places that are really skilled at this can do a good job too. But I would maybe call your provider's office first if you can get through, just to make sure they feel comfortable making the diagnosis. Otherwise, go to one of the city sexual health clinics or another trusted provider who's experienced working with men. Yeah.
And I think the other thing is that I always find that it's helpful if the consumer, if the patient himself or herself tells the provider, I am worried about monkeypox, because that will trigger. So even if that person has not, the provider that may not be their area of comfort zone in terms of diagnosis and management, but just raising that, at least they're likely to then look and hopefully try to seek information and do the right thing.
Thank you. Senator Hoylman.
Thank you, Mark. A question to Mark Harrington in particular. What should we as public officials be demanding of our public health authorities at this juncture? Clearly, testing, we have one of the greatest laboratories in North America at the Wadsworth Center. But should we be asking for more aggressive testing, or are there other components that we should be calling for as local elected, state elected officials?
Well, some of you might recall the initial chaotic period of the COVID outbreak in February of 2020, when the CDC rolled out a flawed test to laboratories around the country that didn't work. And at the same time, the FDA was blocking laboratories that could make their own PCR for SARS-CoV-2 available. And so I remember at that time, some activists were sort of forming a COVID working group at the time. And we called Dr. Dimitri Daskalakis and Dr. Jen Rakeman, who was at that time running the New York City Public Health Laboratory. And we said, what can we do to help get more testing available to New Yorkers? And they asked us to call the FDA and to beg them to allow Wadsworth and the New York Public Health Laboratory to have an emergency use authorization to do their own PCR for SARS-CoV-2. Then it turned out that whether it was a coincidence or not, the FDA did it that night. So before we had a chance to, go to the FDA and demand that they do it, they actually did it. And so New York was actually able to begin testing for SARS-CoV-2 on March 1st. Unfortunately, that was the day the first case was identified. And by then, so many thousands of New Yorkers had already been infected that we had lost a key month and lost the opportunity to identify enough cases before the pandemic exploded and caused, thousands and thousands of deaths that maybe could have been prevented if we'd had a test earlier. So I think that having a scientifically validated test that's closer to the consumer is one of the three most important things that we can do right now. And I think the other two are empowering people to have their own knowledge and tools about how to be safe during an emerging epidemic, like what Joe Sonneman did with Michael Callan and Richard Berkowitz in '83. But using a condom by itself is not going to stop transmission of this particular pathogen, because it can just, your hands can transmit it, anywhere it's on your skin, and possibly if you're highly infectious, through your breath. And so people need to know it's out there and need to know what are the steps that they can do. When, that question about, like, if you get it, should you quarantine? What does that mean? What does quarantine mean? Quarantine is different based on the route of transmission of a pathogen. So if somebody gets monkeypox, they should probably be told to get a test, not to touch anyone, and to stay at home until they feel better. But to say quarantine the same way that we did it for SARS-CoV-2 is not going to work. And then 3, or I might have gone over 3 by now, but Jay said that maybe somebody might be working on a ring fencing protocol somewhere. Well, where? And isn't there a role right here in New York for our Pandemic Research Institute, for our Department of Health and our Department of Health and Mental Hygiene to start working on what those protocols should look like for our city and for our people? Because one thing we learned from AIDS and also COVID is if you wait for the federal government to respond, you've waited too long. And so I'm not saying do it yourself and just go out and make things up and inject yourself with some homebrew, but there's tools that we can use, and there's smart people in our city that we can work together. And as far as public health officials, you should be ringing the chain at the mayor's office, the city council speaker's office, the heads of the legislature, the governor, and the heads of the state and city Department of Health, so that we can have some visibility about what they're actually planning to do. Like I mentioned, we have these tools. What are they thinking? Are they thinking that we're just going to wait for some federal guidance? We've learned again and again that if we wait for federal guidance, we've often waited too long, and our New Yorkers are often the first to get these infections and to suffer hugely. And I want to go back again to stigma and racism and the divisions that exist in our society, and just remind people that we need to be unified, and together we can overcome this too.
My goodness, that was a powerful note that is good for our discussion as we're coming to the end. We only have 2 or 3 minutes left. Maybe we'll just try and get some very, very quick questions in, and then we'll do closing statements. Someone did ask about materials in Spanish. So the City Health Department has prepared some materials in various languages, including Spanish, which we'll include in the information we're sending out here. They have done good translation. There's a question about over-the-counter medication to alleviate symptoms while you're waiting to be seen by a doctor. Any guidance on that?
Yeah, I don't have any. I wouldn't. I mean, obviously, these lesions can be irritating in some people and itch and things like that. The dilemma with itching them, of course, is that you can then spread them to other locations around your body, just like you have with chickenpox. So right now, I don't have any specific recommendations. I suspect CDC's website might have some information, but Wafa, do you know of anything?
No, I don't know for the skin lesions. I mean, I think, I'm thinking of some of the other symptoms, maybe, Jay, there could, certainly for a fever and aches and so on, people can take and chills over-the-counter medication that just to alleviate those symptoms, whether it be something that decreases the temperature or alleviates the pain. I think that would be wise to do that and to use to treat such symptoms. In terms of relief of skin lesions, I mean, people have these traditionally with chickenpox, for example. Again, I'm a generation that did see a lot of chickenpox, using, calamine lotion and other kinds of lotions that can, again, decrease the itching would be advisable.
Okay, thank you. Final very quick question, then we'll do rapid closing statements. Are you still contagious after your symptoms clear up?
So you're contagious up until the point where all of your skin lesions have essentially what we consider resolved. And this is a bit difficult. This is something that you definitely need to be looking at them with another person a trained person, because what happens is similar to if you remember what chickenpox was like in you or one of your children, is these kind of change over time and eventually fall off and new skin starts to form underneath. Once that new skin has formed, and it doesn't have to be, the same skin color yet, it could be brand new skin, has to be covering those, but it has to be all of your skin marks. And that's the problem, because you may get 20, 30, maybe even more than them. So you need somebody else to be looking at them just to be safe. Wafa, anything else to add to you?
No, I think I agree. It's just all of the lesions have to be completely covered with new skin, essentially. And it's also sometimes people can't see some of the lesions, so it's hard to judge. Yeah.
This hour just flew by. We had so much good discussion here. I'm incredibly grateful to you, Dr. Sadr, Dr. Varma, to Mark Harrington. Maybe each of you can just give us a very quick closing, then I'll pass it on to my friend Brad Hoylman, and we'll close it out. Dr. Sadr, you want to give us a very quick closing?
Yeah, I think most importantly in situations like this is we always say communication is to communicate the information, the fact sheets, the accurate information to as many people as possible, particularly vulnerable people and people who are at risk, and to do that rapidly and consistently, especially as others have said at this point in time when we still don't have a good grip on the magnitude of the transmission and the numbers of cases and so on. And I think also at the same time to be, to be measured, and there's no need for panic. Well, we should be measured, vigilant, and at the same time, be attuned to the importance of avoiding stigmatizing anybody. Viruses do not discriminate, and we should not discriminate either.
Yeah, I would just, sort of the two, if I could give two main messages to sort of the general public out there, is number one is, if you're sexually active with men, and you could probably, it should apply to women too, because there's plenty of men who are have sex with men and women. Quick skin checks of your groin and your anal area. Use a friend. Take pictures if you need to. Any lumps in your groin, take them seriously and get checked out. That's number one. And then number two is, as Mark Harrington has eloquently said, we're going to need to rattle some cages to get diagnosis out there better. Even if we get lucky and this whole thing gets squashed and filtered out, everything we know about diseases, and this one means it'll come back in another way and affect different people in different ways. So there's no harm in getting those tests out there and rattling some cages and moving our public health agencies of the federal government faster.
Excellent. Please, Mark Harrington.
Well, you guys already know what I'm going to say, but I would like to see the city and state political and public health leadership work with the communities to take a leading role in addressing this that's much more visible than what everyone except for those present has been doing up to now. And so we only have we have less than 2 weeks before we're going to be celebrating Pride, and we need to see our elected officials at the highest level and our public health officials visibly working together to roll out what's needed to bring this under control and to keep people safe and calm.
Thank you so much, Senator Hoylman.
Thank you, Borough President. Just to say, this is both disconcerting and reassuring at the same time. It's disconcerting because there are so many unknowns, including, whether it's carried successfully through droplets or through the air, whether the test actually works as an oral swab. We heard that it doesn't, and the lack of testing, and the lack of leadership and guidance at the federal level. But it's reassuring because of the messages we got today from people who know best. And our charge, I guess, Borough President, is to continue to press ahead. I'll pledge to work with you to push both the city and the state to get testing and to get information shared with not just the LGBTQ community during Pride, but all New Yorkers who most certainly have a stake in this. Thank you, Borough President, for organizing this.
Thank you so much. This has been just an incredibly informative conversation. I learned so much. We're getting great reactions in the chat. We're going to make this available. So I think what we all can do is help to educate the public. Conversations like this are a huge help. I look forward to partnering with all of our panelists and everyone here who came out tonight to get the information out to New Yorkers so we can stay safe. Thanks, everybody. Happy Pride.